Inverse psoriasis in skin folds, hidden symptoms and solutions. Welcome to today's deep dive into one of the most misunderstood forms of psoriasis, inverse psoriasis. If you've ever experienced mysterious red, smooth rashes in your most sensitive body areas like your armpits, groin, or under your breasts, and traditional treatments haven't worked, you might be dealing with this hidden condition that affects up to 30% of people with psoriasis. I'm here to uncover the symptoms that often go unrecognized and share the latest solutions that can finally bring you relief. What is inverse psoriasis? Unlike the typical scaly, thick plaques we associate with regular psoriasis, inverse psoriasis presents as smooth, shiny, and often damp-looking lesions that appear in your body's skin folds. This condition, also called intertriginous or flexural psoriasis, is fundamentally different because it occurs in moist environments where your skin rubs against itself. On lighter skin tones, these lesions appear bright red, while on darker skin, they manifest as purple, brown, or darker patches than the surrounding skin. The key distinguishing feature is the absence of the characteristic silvery scales found in plaque psoriasis, precisely because the moist environment prevents scale formation. This autoimmune condition causes your skin cells to reproduce at an accelerated rate, completing their entire life cycle in just 3 to 4 days instead of the normal month-long process. Hidden locations and symptoms. The most commonly affected areas include your armpits, groin region, genital areas, under the breasts, between buttocks, belly button, neck creases, and inner thighs. These locations make inverse psoriasis particularly challenging because they're sensitive, prone to friction, and often hidden from view, leading to delayed diagnosis and treatment. The symptoms extend beyond visible lesions and include intense itching that can be unbearable, burning sensations, pain during movement or sexual activity, and a persistent feeling of moisture or dampness in the affected areas. Many patients describe the psychological impact as overwhelming. The intimate locations of these lesions can cause significant embarrassment, social withdrawal, and relationship difficulties. The constant discomfort affects daily activities like walking, sitting, and even wearing certain clothing. Additionally, the warm, moist environment created by inverse psoriasis makes these areas susceptible to secondary bacterial, fungal, or yeast infections, complicating both diagnosis and treatment. Diagnosis challenges. One of the biggest challenges with inverse psoriasis is accurate diagnosis. Because it doesn't present with the typical scaling, it's frequently misdiagnosed as fungal infections, particularly in people with darker skin tones, intertrigo, bacterial infections, or even sexually transmitted conditions when affecting genital areas. Healthcare providers rely on several diagnostic criteria, including the appearance of smooth, shiny lesions, their specific location in skin folds, the presence of intense itching, and sometimes a skin biopsy to differentiate it from other conditions. The diagnostic process often requires ruling out fungal infections through culture tests, examining family history of psoriasis, and assessing response to treatment. Unfortunately, this misdiagnosis can lead to months or even years of inappropriate treatments with antifungal medications that provide no relief, while the actual psoriasis continues to worsen and spread. Treatment solutions. The good news is that effective treatments exist once properly diagnosed. The primary approach involves low-potency topical corticosteroids for short-term use, typically no more than 2 to 4 weeks due to the sensitive nature of affected skin areas. Long-term management often includes topical calcineurin inhibitors like tacrolimus or pimecrolimus, which are safer for extended use in delicate areas. Vitamin D analogs such as calcipotriol provide another effective option for maintenance therapy. For more severe cases, newer treatments include topical phosphodiesterase 4 inhibitors like crisaborole, which have shown excellent results specifically for inverse and genital psoriasis. When topical treatments aren't sufficient, systemic therapies, including biologics like ixekizumab, have demonstrated particular success in treating inverse psoriasis. The treatment approach must be carefully tailored because skin fold areas are more prone to side effects from potent medications. Additionally, managing secondary infections is crucial. Antifungal powders help keep areas dry and prevent fungal overgrowth, while proper hygiene and moisture control form the foundation of successful treatment. Lifestyle management and prevention. Managing inverse psoriasis extends far beyond medication. Maintaining proper hygiene without overwashing is essential. Gentle cleansing with fragrance-free products, followed by thorough but gentle drying, helps prevent irritation. Wearing loose-fitting, breathable clothing made from natural fibers reduces friction and allows air circulation. Weight management plays a crucial role since excess weight creates deeper skin folds and increased friction. Stress reduction through meditation, exercise, or counseling can significantly impact flare frequency since stress is a known trigger. Avoiding known triggers such as excessive alcohol consumption, smoking, and certain medications helps prevent flares. Using absorbent powders in skin folds keeps areas dry, while avoiding occlusive dressings or tight clothing prevents moisture buildup. Regular follow-ups with dermatologists ensure treatment effectiveness and early detection of complications. Inverse psoriasis may be hidden and challenging, but it's absolutely manageable with proper diagnosis and treatment. If you recognize these symptoms in yourself, don't suffer in silence or accept misdiagnoses. Seek evaluation from a dermatologist experienced with psoriatic conditions. Be honest about all affected areas, regardless of their intimate nature, and remember that effective treatments are available. With the right approach, combining medical treatment, lifestyle modifications, and psychological support, you can regain comfort, confidence, and quality of life. Your journey to relief starts with understanding that you're not alone and that solutions exist.